Hi, good afternoon, ladies and gentlemen, and welcome. How are you doing? My name is Andrew Williams, and I will be your host for the next 20 minutes. This is an exciting moment for me and a critical point in this organization's future. Everything we discuss will be hinged on this organization's aspirations as we go forward. So, I'm inviting you, lend me your ears and your minds, and envision the future of this overly ambitious institution. Some housekeeping just before we start. Please jot down all questions and concern until we get to our question and discussion section of this presentation, as well as please place your cell phones and vibrate. This way we can mitigate any distractions. This presentation focuses on nursing shortages in this organization. Nursing shortage is a critical economic issue affecting our patients, nurses, and the organization's performance. We will review a summary of the financial challenges, feasibility, and cost benefits, as well as possible solution to consider for implementations that addresses our current nursing shortages and its ramifications. We will review a brief analysis of how to mitigate the risk and explain proposed solution and the potential benefits. Comprehensively, a review of the proposed solution, ethicals, cultural sensitivity, and equitability will take us into our discussion, concerns, and questions segment of this presentation. A summary of the issues. Nursing shortage in hospitals, recruit a smaller number of nurses than the number that's needed, global challenges, and the implications of higher patient to nurse ratio. Nursing shortage, also known as inadequate nurse staffing or understaffing, is a common economic problem that affects millions of healthcare organizations around the world. Nursing shortages indicate that we have a high patient to nurse ratio or a low nurse to patient ratio, which puts the patients at risk due to lower quality care and missed or omission of cares that were needed for the patient. Nursing shortage is a situation where nurses around the world experience high workload, poor job satisfaction, and burnt out in most facilities. The impact of nursing shortages on patients. Bullet points: poor quality care, high patient readmission rates, increased risk of morbidity, and increased preventable mortality. The effects of inadequate nurse staffing are usually negative. Research explained that nursing shortages ruin patient safety and lower the quality of care. Griffith et al. In 2018. Nurse shortages in healthcare settings cause high rates of patient 30-day readmissions, increased risk of morbidity, and increased preventable mortality. Griffith et al. In 2018. High rates of patient readmissions are usually due to poor care, patient education or lack of patient education at discharge, and is usually influenced by the scarcity of nurses on the units. The high morbidity and mortality risk occur due to poor care again, and sometimes a low supply of timely care that cannot satisfy a patient needs. For example, a catheter that should have been changed on the morning shift is left until maybe the night shift or the following day, puts a patient at risk for increased UTIs. And there are other hospital-acquired conditions such as bed sores and so forth that are potential risk factors related to nursing shortages. Other effects, bullet points: time rationing and missing important patient care services, long wait time, and medical errors and adverse events. Now, patient experience care time rationale. and increased chances of missing the necessary care due to inadequate nursing staff. Agdorens et al. In 2019. Inadequate nursing staff pulled the nurse away from being attentive to all needs of her patients. And, and sometimes it's necessary for that nurse to reduce time spent with each patient in order to try to get to the most important care that each patient is due. So some patient might miss stuff that are not priority for those patients. The nurse shortage subject patient to longer wait time for the services that they need. Thus, this increase the patient's dissatisfaction and their frustration when it comes to the service provided or the care provided by each facility. Another effect is that inadequate staffing of nurses increases the risk for medical errors and adverse events. Research shows that when there's a shortage of nurses, there increased risk for stuff like medication errors, because a nurse is rushing to get to each patient, might miss the medication or might give a patient a wrong medication. Medical errors would also include incorrect diagnosis or injuries, surgical wound adhesion, and falls or unsafe transfusion or IV administrations. How does nursing shortage impact other nurses? Bullet points: low job satisfaction, low retention and increased nurse turnover, increased burnt out, and high workload. The low nurse staffing challenges affect nurses and their practice, their job satisfaction. Nurse staffing lower nurses' health by causing burnout, anxiety, high workload, and physical health, affects their physical health and job stress. Gafoor et al. In 2021. Inadequate nursing staff cause many nurses to be unable to provide basic quality care and even properly attend to their patient. Gafoor et al. In 2021. Additionally, the nursing shortage lowered the nurse satisfaction with their jobs and increased the turnover rate and retention rate for most facilities due to undesirable working culture. Gafoor et al. In 2021. The feasibility and cost benefit consideration. Bullet points: the initiative is to lower the medical error rate by more than 60%, increase nurse patient satisfaction by more than 30%, and lower hospital readmission rates by 67%, and finally lower nurse patient ratio. The feasibility of the project indicates that it will be effective in lowering the medical error rates by at least 60%. Also, the project will increase the nurse job satisfaction by roughly 30%. It is, if the nurse to patient ratio, the number of patients that a nurse is seeing, is equitable to state recommendation, this will also help to improve nurse job satisfaction. Improving nurse staffing will result in reduced adverse events that usually results in medication error, pressure ulcers, patient falls, urinary tract infection, and 30-day readmission. Haddon et al. 2022. Potential risk of the proposed solution. Bullet points: increase expenditure for new nurses in terms of salary and hiring, increase financial burden for benefits and rewards for the new nurses, increase expense in improving the clinical environment where nurses can feel more in tuned with organizations. All right. The main risk of solving the nursing shortage is increased risk and risk from the amount of money that is necessary to hire new nurses in terms of salary and benefits for nurses. There's also be increased spending for training current nurses to improve educational status. Example, increasing from an associate to a bachelor's degree and so forth, as well as improving the environment that the nurses work in to show that the organization is committed to the welfare of nurses. The potential or the implication of failure in the project should be given less consideration than the potential opportunity that the project would provide. Should be the investment should be looked at as an invention, as an investment and not an expense, because improved nursing nurse staffing and increased educational level of those nurses will provide better quality care for a patient, better outcome, and see improved reimbursement in terms of the patient that we see and based on the hospital higher performance outcome ratings and metrics. Benefits of the proposed change. Bullet points: improve patient safety and quality of care, high level of nurse satisfaction, adequate nurse staffing, and decrease nurses workload. Empowering nurses and creating a healthy environment for practice, improve nurse job satisfactions and enhance quality of care and patient safety. Glafor et al. In 2021. The nurses, once satisfied with their job, can become committed and maintain a higher level of performance. These interventions will improve the level of nurse satisfaction and increase the number of employed nurses by increasing the number of employed nurses, thus reducing workloads, burnt out, work-related stress and anxiety, physical health, nurse retention, and reduce turnover. Aligning solutions to cultural sensitivity. Bullet points. The solution do not violate healthcare policies and are thus ethical. The bullet point 2, solutions has no burden and nurses or patients. And bullet point 3, the solution can be used at other healthcare facilities since they are not influenced by cultural differences. The proposed solution are ethical and culturally sensitive. They do not violate healthcare policies, and thus that makes them somewhat acceptable. The solution don't have a burden on the nurses or the patient. They the solutions are to increase the number of nurses. Therefore, taking burden off nurses is actually what the solution does, and they are also improve the way the nurse practice because they are no longer stressed or burnt out, and they are able to focus more on quality care and outcome of the care for their patients. The ethically having more nurses help to make sure that patients are able to receive the care that they need distributed fairly and equitably to everyone in the facilities, and no patient has to be prioritized or lose care or lose the timeliness of care, which would be an ethical issue. The solutions also increasing the number of nurses will also at that point be able to educate nurses or send nurses for education in terms of culture, therefore improving cultural sensitivity for those nurses. And since healthcare communities are influenced by the diversity of their culture, having a nursing staff that is culturally sensitive improve the quality care and outcome of the care for those patients. We have now come to our discussion, concerns, and questions segments. We are hoping to discuss any questions or concerns that you might have, and let's talk about any potential recommendations that you think of.